Uh, I would like to invite Dr. Vibhu Ranjan Gupta sir to kindly deliver his expert talk on dialysis concern. Dr. Vibhu Ranjan sir is a veteran administrator and stalwart of quality and also organizing secretary for this today event. And he is the group medical director and Sarvodaya Healthcare Faridabad and principal assessor for NABH, faculty for program on implementation for NABH 5th edition standards, prominent faculty for various courses offered by NABH and CAHO. Dr. Vibhu sir was also the ex-medical director at Medanta in MedCity, Gurgaon at Fortis Escorts Health Institute, Delhi. Over to you, sir.
So, consent means willingness of a party to undergo examination, procedure, or treatment by a healthcare provider. It may be a implied consent. For example, if patient is coming to the OPD, it means he has already given a consent that he's utilizing this particular service. And in law, it means active acquiescence or silent compliance by the person legally capable of consent. In India, the legal age of consenting is 18. So, in dialysis, it has to be informed consent. So, in this slide, it should not be that we have to give a just paper to sign by a patient or his relative. So it has to be discussed in detail and to tell that whatever we have discussed, it must be understood by the person. So this slide represents that informed consent must be explained nicely. Next, please. So important requirement of a consent is that it should have the name of the doctor performing the procedure, and the consent must be bilingual. And bilingual means it doesn't mean Hindi and English. It should be a local vernacular language of that particular state. And if the person is using that regional language, the patient and the witness must sign on that regional language paper. And the consent must explain the risk, benefit, and alternatives. If there are any other alternatives, for example, if we are talking of hemodialysis here, so can it be a CFPD or any other type of latest dialysis? So those sort of alternatives must be explained. Next slide, please. Consent shall be documented before the procedure. That is the requirement, because it is not useful to take the consent during the procedure or after the procedure. It must be done before the procedure. And there must be at least one witness who has to sign the consent. And usually the witness person should be the same who is present throughout the procedure. Sometimes in our Indian setup, we see attendants are changing every time. And for example, dialysis is only 4 or 5 hours procedure. So that particular person must be explained and he must be the witness signing the procedure. In case the patient has to undergo, in case the patient has to undergo a procedure repeatedly for a long time, but we are discussing in dialysis. So as per the NABH guidelines, we must take one consent and then it should not be, it should be endorsed at least every time, but its validity must not be excluded after 6 months. And if there is any change in treatment or any change in modality, then the new consent has to be taken. Next slide. So consent shall be taken from the patient above the legal age, above 18 years. And if the person is above 18 years, then there must be the reason which must be explained, that why parents are signing for the child, or what is the different reason why patient is not able to sign. So when we go for assessment, we see that patient signature is not there. It is signed by an attendant. So, but in legally, if patient is adult, he must sign all the consent. Then hospital should have a documented policies that who can give consent and what is the policy if patient is not able to give the consent. Then if attendants are giving the consent, then what is the order? And in legal language, the order of preference is of next of kin is first is spouse, then his son or daughter, then parents, and then the sibling, brother or sister. And sometime in situation, it can happen in dialysis that if there is any life-threatening situation during the procedure or before the procedure, then the other doctor can sign the consent. And ideally, the consent should be signed by the nephrologist or the medical officer who is the part of the team during the dialysis. Next slide, please. So consent is no longer an option. It is now a must under the current guidelines and regulation that patient must give informed consent before the procedure. Next. If we see the accreditation guidelines, so one is NABH guideline, which we have already discussed in PRE chapter. It is PRE 4B in 5th edition of NABH. But since Dr. Rana is here and QA standards have already got dialysis standards. So in dialysis standards, the consent is covered in PRE 5, where all these parameters, who can give consent, what are the risk, benefit, and complications, and the consent must be taken by the person performing the procedures. These are well explained in QIA standards for dialysis in PRE 5. Next slide, please. So when the hospital is taking consent, as per the accreditation guidelines, they have to formulate the policy that what are the guidelines, and doctors and the staff, they should familiarize themselves with guidance relevant to the area of practice. Next slide. So hospital has to make the documentation for guidelines. So the patient must be given information in a way that they can understand. It must be explained in their local language that what is the consent, what are the patient rights, what they can understand in that local language. Then patient has also right to give or withhold consent prior to examination or during the treatment. Then if there is a child or sometime adult is in that condition where he is not able to understand, in that condition, the physicians we must be included in the part of taking the consent. Next slide. So in documentation, informed consent or verification of informed consent must be obtained prior to administration of the procedure. And since dialysis involves sometimes other consents, for example, giving medication, giving transfusion of blood, or doing some procedure, for example, some jugular or some subclavian cannula has to be put. So all these consents must be taken along with the dialysis consent during the procedure. Next slide, please. Another important aspect is duration of informed consent. So duration of informed consent is very, very important, but in legal, this thing, it is mentioned that informed consent should be obtained and documented no longer than 60 days. It means medical legally, if patient is coming repeatedly for dialysis or they are coming in OPD, the consent should be done not beyond than 60 days. And patient has also right to revoke the consent. So patient may revoke consent verbally or in writing. This should be communicated to the patient physician and documented in the medical record. Next slide. So just to summarize, the component of consent, that the name of the doctor, consultant, or the team member, he must take the signature. Then brief description that what is the type of procedure, whether it is hemodialysis or whether it is CAPD. Then we must explain the risk, benefit, alternatives, or complications, whatever can happen during that procedure. Then date and time is very, very important during the consent. And if some other procedures have to be taken, then they must be part of a consent. Next slide. So this we have already discussed about the component of consent. Next slide. So one part is consent, but one can only take adequate precaution and act with care and diligence. Maintaining good relationship with patient often works better than the best informed consent. Since this is very, very important and very true in our Indian setup, whatever documentation is there, but if the patient and their family trust the physician or the hospital or the dialysis center, the trust is the best thing for a relation with a physician. Next. So one cannot know with certainty whether a consent is valid until a lawsuit has been filed and resolved. So why I have put this slide? Because you never know nowadays, because of lot of TPAs and lot of medical negligence cases against doctors. So we must try to complete the documentation to ensure that we must be fully compliant with consent procedure so that no lawsuit or no medical legal case can be put against any doctor or hospital as far as consent is concerned. So that's all from my side about the consent. Thank you very much. And thank you once again for giving this opportunity.